Good afternoon. This is Karen Yaboa Normant from Pros for MPs. Today on Highlighting the MP, we're going to discuss pediatrics. So I have with me today Pediatric Nurse Practitioner Dr. Adaugo Oriji. Thank you so much for joining us today.
Thank you so much for having me. It's an honor to be here. So thank you for inviting me again. Like you said, my name is Dr. Adaugo, Dr. O, whatever you want to call me. Appreciate you having me here today.
Thank you again. How long have you been working in pediatrics as a pediatric nurse practitioner?
Yeah, I've been working as a pediatric nurse practitioner in the same pediatrician's office for 4.5 years now.
Wow, talk about longevity. That's amazing. Can you tell me what your daily schedule is like working in pediatrics?
Yeah, so every day is a little bit different. And so some days I might see more well visits or physicals rather than sick visits. And typically I see patients from newborns to 21 years old.
You see up to 21. Okay.
Mm-hmm.
And what are the most common diagnoses in pediatrics?
Yeah, the most common diagnoses that I see are usually ear infections, upper respiratory infections, uh, pharyngitis or sore throat. I may also see asthma exacerbations, constipations. Um, yeah,
Yeah. So I bet you all diagnosed all year round.
absolutely.
Do you also do you see any rashes like the viral exanthems at all?
Oh yes, yeah. I just named a few things that I see on a normal basis, but definitely rashes is a big one. You know, eczema, atopic dermatitis, like you mentioned, viral exanthem, and just different type of skin issues. I see that multiple times a day.
And what made you decide you wanted to become a pediatric nurse practitioner?
Yeah, so from a young age, I absolutely love children. I love seeing kids. I love caring for children. They always brought me joy, and so I always knew in the back of my mind that there was a good chance that whatever career path that I went with was going to involve kids. And so when I decided to become a nurse practitioner, I knew that I was going to specialize in children because I knew that's what I love. I knew that age group was my passion, and yeah, that's why.
Yeah, so to add to what you said, I love kids as well. In high school and in college, I was a camp counselor, so I also have a passion for kids. I'm glad you followed your passion. So, Dr. Adaugo, congratulations on getting your Doctorate of Nursing Practice degree. Can you tell me what you did for your DNP project?
Yeah, absolutely. So the point of a DNP is to change practice. And so the program that I was in was called the Postmasters Executive Weekend Model. And so that's just a fancy name to say that most of us nurse practitioners have been in practice for a few years. And because of that, we've seen like a deficit or something that we want to change in our practice so that we can give better care to our patients. So specifically to me, I saw that the way that we diagnose, assess, and treat our asthmatic patients was through clinical judgment only, which is fine. We've all been thoroughly trained as to how to care for our asthmatic patients. However, there are guidelines out there that are reputable and also evidence-based that were created to help guide us and aid us in our management of asthma patients. And I realized that we do not utilize that in our practice. And so I wanted to do that. I wanted to utilize the guidelines. So the guidelines that I actually chose is called the GINA guidelines. So that's short for the Global Initiative for Asthma Guidelines. And I chose to focus specifically on the assessment portion of the guidelines for many reasons. One being that the program is only a certain amount of time, and I wanted to make sure that I chose something that was going to cause change, but also would allow me to graduate in that particular time. So I decided to specifically focus on the assessment portion. And so the assessment portion consists of asking questions regarding GERD, asking questions about history of GERD, history of seasonal allergies, asking about BMI, assessing inhaler technique, implementing a spirometry test, and also implementing the CEAC questionnaire. So what the CEAC questionnaire is, that's short for the Childhood Asthma Control Test. And so that test determines whether a patient's asthma is controlled or not. And so both the child and the parent is given this questionnaire and asked questions to determine where they lie in terms of their asthma control. So an example of a question would be, how is your asthma doing today? Are you having, An example of a question would be, during the week, have you had any symptoms of coughing, wheezing, shortness of breath? And then they can answer, not at all, some of the time, most of the time, all of the time. So that would be like an example of a question for a child. And so if you if your answer was 19, or I believe it's 19, if it was 19 or less, the test showed that you scored a 19 or less, then your asthma was out of control. Mm. And so this is the intervention that I administered to my patients. And so when the participants that I was able to acquire for this project, I found out that 70% of my participants pre-intervention, their asthma was out of control.
That's a big percentage.
That is a very big percentage. Mm-hmm. But when I implemented the intervention, when they came back for their 1-month assessment, their only 10% of the patient's asthma was out of control, which is a huge decrease. Mm-hmm. And so, so I found out that, and I noticed this during the intervention as I was implementing my project, that a lot of my patients, even though, all of them will say, oh, I know how to use an inhaler. The parents will confirm, yeah, they know how to use an inhaler. We got this. We've had asthma for years or whatnot. The truth was that after asking them to demonstrate, they did not know how to use an inhaler. So I spent a considerable amount of time at these visits teaching my patients how to use an inhaler correctly. And so I think that is the main reason why I saw such a decrease in asthma exacerbations. It's not that my patients have severe asthma. It's simply that they don't know how to use an inhaler. And so, we decreased the chances of them having to, of us having to add a new medication by just simply teaching them how to use an inhaler.
Very important topic. Like you stated, it's very important to always assess technique, such as trying to see if a patient knows how to use their asthma inhaler correctly before adding more medication, such as an inhaled corticosteroid or a subcutaneous injection, such as Xolair. I'm glad your project helped decrease the percentage from 70% to 10%. Great job.
Thank you.
And what would you say is a significant pediatric patient case that comes to mind when you think of your career in pediatrics?
Yeah, so one notable case was, so I was doing a routine 2-month well visit on one of my patients. And as I'm assessing my patient, I'm listening to the patient's heart, and I hear a very loud heart murmur. Right. And whenever I hear a heart murmur that loud on a young patient like that, I assume that the murmur is congenital and that the patient is being followed by a cardiologist. So I look in the patient's chart and history just to confirm, and I didn't see anything in the patient's history at all. So I asked the mom, were there any complications during birth, baby premature, is the baby followed by a specialist, asked her a series of questions. And the mom said, no, the baby was fine. Nobody said anything. Everything was great. Was not in the NICU, no issues at all. And so that alarmed, my heart sank. I'm not going to lie, my heart sank. And that, alarmed me, but I was very calm. And I just let the mom know that the baby needs to see the cardiologist as soon as possible. So thankfully, the mother listens, and the baby saw a cardiologist and was diagnosed with a pretty serious heart condition and is scheduled for surgery. So that was pretty notable.
Thank you for sharing that patient case. You saved that baby's life. Hopefully, the baby is doing well. And my last question is, what advice would you give to nurse practitioners who would like to work in pediatrics?
I say go for it. I mean,
Okay.
I think I think that if you are similar to me, your story is similar to mine, and you know that you are passionate about children from a young age, or you know recently been passionate about kids, it doesn't matter, and you know that there's something that you will thrive in and something that you will enjoy, then go for it. Because personally, for me, it has been one of the best decisions I've ever made in my life. I absolutely, absolutely, absolutely love what I do. It is a joy to go to work every day, and I couldn't see myself doing anything else. I remember when I was getting ready to start my master's and I had to choose a specialty. I had a lot of people in my ear telling me that I need to do F&P, do other specialties because, that's where the money is, or you're more marketable, whatever. But I knew for me that pediatrics was my passion, and I knew that that was most likely the only way that I was going to thrive. And so looking back, I'm so glad that I listened to what I wanted to do because like I said, I absolutely enjoy it, and it's a blessing, and it brings me joy to see these kids' faces on a daily basis. So go for it. I don't think you'll regret it, and you'll be making a really great decision.
Adaugo, that is simple, common sense advice. I would definitely listen to your heart, listen to what you want to do. Don't let anyone influence you in making any decisions that may affect your career and your future. Do what makes you happy. That's amazing advice. Thank you.
Absolutely. Thank you so much for having me. This was fun.
Thank you, girl. Bye.
All right. Bye.
Bye.